So what we did during the summer was we popped out a Microsoft Forms survey to ask you as providers, you know, what else is it that you need? What would be useful? Because we'd had some feedback that people wanted more information. They wanted maybe some slightly different information that was a bit more interactive, looking at worked examples, things like that. So we've tried to respond to what it is that people have told us that they want and need from us in terms of furthering their understanding of self-evaluation and how it's used. And hopefully as well, we'll share some of those experiences, people. So we have a video later on that talks about providers' experience of self-evaluation as well. So you can see how other people are using it. Okay, Anthony. So this is our first question for you. So using those AHA slides, so either the QR code or the link that's in the chat, you should see this question. So just pop in your answer. It's anonymous. We won't see who's answered what. Just gauging where people are at right now, how people are feeling about self-evaluation, using it in practice. So immediately we've got quite a mix of people in that. I can see that we've got about 50 people that have managed to get into the slide. So there's still maybe a few people that haven't got on yet. If you're really struggling to use the slides or to get access to that, then just pop your answer in the chat for us. That's no problem. We appreciate that, you know, technology is sometimes a little bit temperamental, but yeah, just pop it in the chat. There's a few people saying, that makes sense why it's not 100%, that confident isn't an option. Okay. Interesting. Okay, well, if you are confident, I mean, just let us know. We've got quite a few people said somewhat confident. And it's, yeah, thrown as another spanner. So when we use these slides on Monday, for some reason, they all turned out dark purple and nobody could read the writing on them. So it's just, just again, technology showing that technology is in charge, not us. Okay, so apologies that the confident is missing. But like I say, if you want to pop that in the chat, that's your preferred option, that's fine. Okay, so most people seem to be saying somewhat confident. A couple of people very confident, and again, some more that are not at all confident. So kind of in the middle with that. So, I mean, that's good because actually, you know, we're not here to teach you, you know, the basics of self-evaluation, you know, because we have guidance for that and we've done webinars on that. So this is more about, you know, okay, so you maybe have a bit of understanding of using it. How can we further that? How can we, you know, give you that overview to cement some of that knowledge and then develop it a little bit further, take it that step further for you. So that's good. And we are going to move on to the next slide and I'm going to hand over to Linda now.
Okay, thanks, Sharon. Just want to echo what Sharon said, you know, a very warm welcome to you. It's great that so many people have turned up today because I know how busy you are. And we know that people are at different stages with self-evaluation, and I think doing that confidence thing there is really useful for us to help and encourage and support people to use self-evaluation, because we know you've had a really difficult time. It's been really terrible in social care for the last few years. So we know that you've got other priorities to work on. So we are trying to be supportive and really encourage people to start using self-evaluation. And as I say, I know people are at different stages, and it's good to hear the stories of where people are. So just a kind of quick recap about self-evaluation social care, just looking at the guidance that's available. The Self-Evaluation for Improvement, your guide, that came out in 2019, but it's still quite useful for people, services to use. It's got some good information in it. The most recent guidance was the Self-Evaluation Tool Guidance, which has, I think, started being published in 22, and we've had different publications since then, but it's basically telling you the same information. The good thing about the tool guidance is there are links to Word documents that you can use and different templates that you might find useful. Some people have found them useful as you can download them and you can adapt and change the information that's there to suit your own service. So some people have found that really, really useful. I'll pop a link in to the guidance at the end of the my spiel, so that people who haven't got a copy will be able to access that and the tools that are there as well. Okay, so self-evaluation is a continuous process. It's not just a one-off thing. And as I say, we're trying to encourage services to do that, because it's crucial to understand just where you're at and how well you are doing. And it's good to know all the good things that are going on in your service, because sometimes I think we forget about that. Everything seems to focus on round about the things we're not doing so well. So it's good that self-evaluation highlights all the positive things that are going on. The first two questions really help you establish a sort of baseline of where you're at. And the third question, what are we going to do now, really sort of helps you then to decide, well, where will we start our improvement journey? What will we do and take forward? And you can use the improvement plan to help you do that if you want to. You might have your own tools that you've devised, which is great. But as I say, there are tools connected, linked into that guidance. So hopefully you will find them useful. So talking about asking questions, we've got some more questions for you if you don't mind. Next slide, Anthony, please. I see Anthony's put the link there, so that's great. So could you, using the AHA slides again, using your phones, hopefully this will work again this time. Could you tell us what's good about your service? What are the good things that you're doing that you know, that you're working on, working with? Tell us, what do people tell you about what's good about your service? What does staff tell you? Okay, flexibility. Person-centred, yeah, that's really good. Staff caring. Personal care. Relationships with people. Life sharing, positive outcomes. A lot of person-centeredness and relationships. Responsiveness. Yeah, staff caring and kind. Good team, responsive. Homely atmosphere. Personalised. Staff feel valued, and that's so important, isn't it? Training. Offer people the chance to return to increased functional abilities. Mock inspections, right? That's good. People, training, again, well-being. Fantastic teams, that's really good to know. Staff tell you, that's good. You've got good communication with staff that are sharing things with you. That's really great. Diverse range of staff and residents. Okay. So lots of really positive things that are going on there, and you're still adding to it, which is great. We will be able to share the slides with you once the session's finished. So you'll be able to look at this yourselves and see what answers came up. So lots of really good things about person-centeredness, about staff, teamwork, values, and looking at different ways that you're accessing information. Okay, that's great. Thank you very much for that. Could you have the next slide, Anthony, please? Okay, so you've told us what's good about your service and lots of positive things going on there. What kind of things are you looking to improve in your service? Are you aware of what needs to be improved? Are you starting that improvement journey? Could you give us some ideas about what you're looking at to make improvements? Staffing levels, yeah. Absence. Okay, retention, right. So a lot of issues about sort of staffing, retention of staff and getting staff training, recruitment, staff absence. Gosh, a lot of stuff around about staffing that you're trying to improve. Participation for stakeholders, seeking feedback, Okay, training, improve staff morale caused by lack of staff coming into the industry. Yeah, so that is still quite a difficulty, isn't it? Trying to recruit staff and also retain staff. That must be quite a difficult situation to deal with. Meaningful feedback, you're good. Start to look at getting meaningful feedback, which is really important. Self-evaluation, being able to deliver outcomes. That's good. Engagement and retention with families. Yeah, that's really important, isn't it? It's certainly as part of the self-evaluation process. That's really good. You're going to improve by using self-evaluation. That's really good. Celebrating success. I think that is really so important because, as I said earlier, I think we tend to focus on what we don't do well when we could really be concentrating more on what we do well and celebrating that success. That's great. Okay, quality standards, funding, staff retention. Yeah, so a lot of similarities there of the improvements that you're all trying to work towards. That's great. Okay, thanks for that. Could we have the next slide, please, Anthony? Oh, I see there's lots of comments coming up in the comment section in the chat too, so that's really good. As I say, we'll be able to share these slides with you, so you'll be able to see the comments that people are making. Okay, so my next question and my last question is, how do you know how good you are and what areas you need to improve in? Where do you get that information? Okay, so people are telling you, staff surveys, audits, people you support. Yeah, a lot of your quality assurance, inspection, yeah, staff involvement, feedback, service user surveys, reviews, yeah. So lots of different types of information that you're getting back that let you know how good you are. And verbal feedback, yeah, okay. So from what you've said and what you've told us, you're already looking at developing and you've already started that self-evaluation process by the information that you've said about what you're doing well and what you need to improve, and you're doing all the right things at what you're getting feedback in and what different systems and processes you're using to know how good you are. So that's really good. So thanks for sharing that information. Really do appreciate it. Okay, next slide, please, Anthony. Just going to quickly run through the sort of self-evaluation process. And I'm just going to look at the first two questions and Sharon will take over and look at the third question. So the first question is, how are we doing? So how do you know how you're doing? Where do you start? Where do you get the information about how good you are doing? And you've already kind of pointed to where you're getting some of that information. You've talked about feedback, looking at some of your systems, etc. So that's really good. You could start by looking at the quality framework, but obviously we wouldn't advise you to look at all the quality framework or try and look at the quality framework and evaluate all of it against your service. We would advise you to start small and maybe look at one element of the quality framework, maybe a key area. If you're not confident in using the quality framework, it's good to start small. And then once you develop confidence and staff develop more confidence in maybe using self-evaluation, then you can use that to look at different aspects of the quality framework and spread the improvement through there. I suppose it's important to look at maybe some of the health and social care standards or other best practice standards, because they're quite good at giving you a kind of measure of where you're at. And you can also use things like the quality illustrations, which are part of the key questions within the quality framework, because they give you a measure of what a very good service is like and what a weak service is like. So that might be a starting point if you wanted to start with something like that. And that gives you the information about how you're doing. One of the things that is important about how are we doing is getting that feedback and making that feedback accessible for people. So it's developing and devising questions that people who use your service will be able to understand and interpret, and not making them too complex because if they're too complex, sometimes people don't know how to answer them. And sometimes how you design maybe surveys and things like that can be quite useful to have sort of comment boxes so people can add additional information. So as I say, there are some Word documents on the links to the toolkit, so there might be some information there that might help you get started if you haven't. And I know, as I say, a lot of you have probably got other tools that you use and other designs that you've got in place for questionnaires and things like that, which is really good to know. Okay, so next slide, please, Anthony. So getting feedback, as we've discussed, is really vital to letting you know about your service and how good it is. And a lot of you are doing that already. And basically, it's getting feedback from anybody that has any connection with your service, because they can all give you some valuable information about how good your service is and areas that you might need to improve in. So it's asking all the people who use your service, their families, relatives, friends, carers, and getting them involved. Asking your staff, I think it's really important, and a lot of you are saying that you are involving your staff. It's really good for staff to get involved and to be able to feel comfortable about giving you feedback about how good your service is and maybe what's important to them about how they could improve, how the service could improve. And it's good to give that communication to all staff about how good they are and getting feedback from them. As I said, it's useful to anybody that's involved in your service, such as other professionals that might be connected, such as social workers, etc., or staff from the Health and Social Care Partnerships. It's quite useful to get some information from them. I know they're always busy, but it is quite good to get some feedback and from stakeholders as well. So you can get feedback in various formats, and I'm sure you've all got various ways of doing that. You'll know the people that use your service really well and how best to communicate with them. But you can use sign language, such as shown there in the slide: thumbs up, thumbs down, emojis, smiley faces, not smiley faces, or you could use things like text. A lot of people quite like social media these days, so social media might be a good platform to use. And it's really important. You'll know how well you can connect with people. Some people might like to sit and talk to you on a one-to-one kind of basis in confidence. You might want to use sort of focus groups, small groups. People might feel a bit more comfortable doing that. You might want to look at, I know some places have things like afternoon teas with cakes, which is quite inviting for some people to come along rather than just having a meeting. So people seem to get encouraged to come along. I don't know if it's for the cakes or so that they can join in the conversation and give the feedback, but it's maybe one thing to think about. The relatives as well can give you really good feedback. And again, you could do that individually. You might want to do it on the telephone, or again, have that afternoon tea with cakes. And I know some of you do use questionnaires. And again, I think it's keeping them simple so that people in your service and relatives will be able to read them and understand them and be able to give you the rich information that you need. Okay, next slide, please. So moving on to question 2, and how do we know? And you've kind of answered this already. So there's different elements that feed into self-evaluation. As we said earlier, it's a continuous process, and you can use things like benchmarking from the quality framework, which we've talked about. I mean, you could also use things like your last inspection report that might start you on your self-evaluation and improvement journey. But benchmarking against the quality framework is probably a good place to start. Questionnaires are really important that feed into self-evaluation and give you that important information, and really getting good participation from people that use your service And it's important that everybody in your service is included. So trying to reach out and communicate with people is really so important, and getting people involved. And quality assurance plays a really important part, doesn't it, in giving you information about how you know how good you are. And you've said that in the AHA slides that you mentioned earlier. So these are some of the key elements that will help you focus on how do we know how good we are. And that will help you go on to your journey about, right, what we're going to do next. Next slide, Anthony, please. I think we've already covered a lot of this, but gathering your evidence is really vital to doing your self-evaluation journey. It includes, as we've talked about, people using the service, feedback from staff, relatives and stakeholders. And another good way of doing self-evaluation is doing observations of staff practice, but not just staff practice, but just people experiencing support or care, just doing general observations, and also getting staff involved in that. Staff might like to be involved, and I'm sure a lot of you do involve staff in doing observations and looking at best practice. And I think it's good to, it shouldn't just be for the manager to have to do. It's good to involve a whole team, and I'm sure a lot of you do that. And there's quality assurance activities, and a lot of you have mentioned that, so I can see that that's an important part of you being able to establish your self-evaluation. One of the care home manager I was speaking to the other week, she's now started asking relatives to get involved with observations of the environment, and that seems to have worked out quite well. I don't know if other people are using relatives to help with self-evaluation, but I thought that was a really good incentive and a good motivator to get relatives connected to the service. And as we've said, benchmarking against good practice and the quality illustrations will give you a really good baseline of where you are and where you need to move to. So I'm going to hand over to Sharon now, and she'll take you over to question 3.
Thanks, Linda. Okay, so question 3, what are we going to do now? To me, this is a really important one, and it will show how well you've answered the other 2 questions. So hopefully by the time you get to this point, that what we're going to do now, you'll have a really good understanding of where you're at and why you're there, and maybe what you need to move forward. So this is about, what did you learn from answering those first 2 questions? Hopefully you're going to have learned what people's experience is. And that might be those that are using your service or experiencing care, the stakeholders, the relatives, your staff even. What are people's experiences? And those are going to be different depending on, who you're asking and what you're actually asking. You should also know what's going well and maybe what's not going so well. So this question is about pulling all those things together and making that evaluation. So we talked to you about using that evaluative language, bringing it all together. So it's not just about saying, well, actually people were happy or they weren't happy, and what, what weren't they happy about? Can you unpick that? Was there some reasons maybe behind those things? And, feedback is often a very subjective thing. So there might be things in there that, can be relied on or maybe not relied on due to other knowledge you have around the service, and maybe somebody's experience of a particular thing. So there's going to be lots of different answers in there, lots of different evidence that you can pull upon to give yourself that informed impression of exactly where you're at and what you need to do to move forward. And some things might be great, might be just reinforcing that things are going well, and actually nothing within that area is a priority to move forward with, but you have other priorities. And like Linda was saying earlier, depending on what you've picked to look at, that might be that you've chosen something from the framework that's something interesting to look at and assess where you're at, or you might be responding to things like requirements or areas for improvement that have come from an inspection report. which obviously then the priority level is going to be a little bit different because you want to get those things resolved and make improvements in those areas. So it's always going to depend on what you've looked at. You'll also usually learn from answering this question whether you asked the right questions in the first place. So sometimes, and again, Linda mentioned this, you have to think carefully about what is it you want to know, because by the time you get to this question, you'll realize whether you asked the right questions to get the right information or not. So hopefully, like I say, that journey of asking and answering the first two questions will lead you to this bit, and it'll be really clear about where you need to take things forward. So next slide, please, Anthony. So all of this information that you've learnt, that evaluation that you've made, is going to start populating your improvement plan. So we've just got an example improvement plan here, and you can see that we've got a couple of things in there. So maybe if communication's been an issue, maybe that's something you want to improve. How would you go about that? Identifying those actions and some timeframes around that, and identifying the people responsible. This is probably nothing new to most of you. Most services have service development plans, improvement plans. They call them all kinds of different things, but they have plans in place. What often people forget to do is the last column there, the kind of where are we now, the review. They make the improvement plan or the action plan, and then it doesn't really do anything. It's not kept live. So this is about everybody knowing what this plan is there to achieve. And then when it's reviewed, that the reality is recorded. So whether that be, we don't know actually where we're at because we haven't had chance to follow up on this, or yes, we plan to send out fortnightly updates to family members, but we haven't actually managed to do that because lots of staff went off and then there wasn't the capacity to do it, but we're planning to start it again from next month. Whatever the reality is of that, it doesn't matter. All that matters is that, you can see that where you're at, whether you're achieving what you've set out to achieve, and you keep planning to move forward with it. So a lot of the time people ask us about inspections and what people inspect to see in these plans. And again, it's that idea that where you're at, that nobody needs to come tell you where you're at, that your own quality assurance mechanisms are doing that job for you. They're fit for purpose, essentially. So if you're identifying that your risk assessments need updating, well, then that's good. So you don't need somebody to point that out for you because that. Where they need to be, where to take it. So again, it's about that keeping it up reviewed. People aren't necessarily going to make a judgment of whether you achieved it or not if you're moving in the right direction. So next slide, please, Anthony. So what we thought would be useful is almost going through a bit of a worked example and focusing on personal planning, usually because it goes across service types. So it's quite a good one to focus on. So what we want to identify is, how do you know what the level of quality is? So if you're looking at a self-evaluation in terms of your personal plans, what kind of things might you look at? What kind of things might tell you where that level of quality is, or what people think about it? What kind of questions might you want to ask people, and who might you want to ask? So all of those kind of planning elements to it, what do you want to ask? Who do you want to ask? How are you going to judge what the quality is? Have a think about those things in order to answer the next question that we're going to move on to. And the key areas we're going to focus on here are two key areas from key question 5 in our quality frameworks. And that's that personal plans are reviewed and updated regularly and as people's outcomes change, and that people are involved in directing and leading their own care and support. So these are actual key areas. And like Linda was saying earlier, you want to keep it small. Don't be saying, right, I'm just going to go and evaluate the whole framework, because that's just an effort and will take you forever. And you possibly won't get out of it what you need to, because you'll be so tied up in trying to achieve all of it that you possibly wouldn't do a great job of any of it. So keep it small, really focus in on things that are useful to you and where your service is at at that moment in time. So, like I say, we're just going to use those 2 key areas to have a think about how we would do a self-evaluation. So next slide, please, Anthony. So this is back to the AHA slides again, for you to populate answers to those kind of questions of how are you going to know where you're at? What are you going to use? What kind of things are going to be helpful for you? So I'll give a moment for people to start populating that. Okay, so while that's coming, I'm just going to have a look in the meeting chat. So somebody was saying about considering whether the service is achieving the aims and objectives of the service. Yeah, I mean, you know, obviously we want to know that that is happening. But again, that might be quite a large area to cover, and you might want to break that down into smaller things in terms of, you know, what are those kind of different objectives? You'll have multiple different ones within that. So sometimes breaking it down in order to find out, well, what are the questions we need to ask? But yeah, that's great. So quite a few people putting in, so with our personal plans, we're going to be looking at reviews, audits, outcome star, yeah. Audits of care plans, quality assurance by other colleagues, feedback from families. So what kind of things are you going to be looking at with reviews? What kind of questions are you asking in your audits? If you're thinking specifically about those 2 key areas, can you narrow it down? So rather than just, I'm going to do an audit, what are you auditing? Is there a specific questions that audit might need to cover? So communication people have got there with staff and residents, pre-stay reviews, outcome monitoring. Yep, review schedules. Yep. More audits, daily meetings with staff. Yeah, so that's a more comprehensive one there. So daily meetings with staff and management to ensure changes in residents' needs are captured and changes made as necessary. So that's more specific. That's a clear kind of thing that you're aiming towards, and that you can maybe make a judgment of. You know, are those meetings happening? Is that information being communicated? And is it actually being captured and maybe translated into the paperwork rather than just kind of verbally handed over? Speaking to staff, yep. Sometimes it's the most, you know, obvious things, isn't it? The person's wishes, yes. Making sure that those kind of things, plans up to date and relevant. Again, yep, getting more personal review of personal plans by external consultant. Yeah, and I suppose that's something, that comment there, the review of personal plans by external consultant to see if someone who doesn't know the clients feel they could care for the client. And I guess that's what you're getting on inspection, isn't it? So we come in and we don't know people, but we observe people and we may then track them through their personal plans. And sometimes it's very obvious to us, well, actually, what it says in the plan isn't reflective of what I've seen that person, you know, needing to happen around them, or some of the needs that they may have. You don't need to necessarily have some kind of external consultant or put an extra resource around that. It could be almost like a quid pro quo, having that critical friend, as we call it. So maybe the manager of another unit or another service, somebody where you could swap over and you go and have a look at maybe some of their plans. They come and look at some of yours, you know, utilizing each other, because you would both benefit from that activity. And if you're both going to undertake it anyway, then it might be more useful to do it for each other's plans. So yeah, having that fresh pair of eyes. Quality assurance audits from directors, yeah, again, it's that idea of that fresh pair of eyes, isn't it? Evidence of service user involvement. Yep, speaking with people, were changes recorded? Yeah, so people have started becoming a bit more specific with that. So those are some of the things that we could use to look at, how are we doing? Judge against the quality indicators with person always at the centre. Yep. Quality framework communication. Yeah. So that's some really good bits there. Really, really good information. Next slide, please, Anthony. Okay. So this is our made up bit in relation to that. So we've pretended that we've done the first bit. We've looked at where we're at. We've asked people, and this is kind of the conclusion that in our made up one we've come to. So from answering the first questions, this is our evaluation. We're saying that, we've gone out, we've asked people that use the service, we've asked relatives, we've spoke to staff and a couple of stakeholders as well. And all in all, we've come out as good. That's where we've evaluated ourselves to be at. And that's because we've asked questions around auditing, we've quality assured a number of personal plans, we've got the feedback from people, they're all saying the right thing. They're telling us that the plans are person-centered, they demonstrate involvement of people or their sort of representatives, family, whoever it is, if they don't have capacity themselves. So we've done all that work, we've answered the question, but we also learned that some things could be improved. So again, just for the sake of the example, we've said that we found here that 3 of the plans we looked at hadn't been regularly reviewed. And for one person, maybe their needs had changed and this wasn't reflected in their risk assessment. So we've been clear about what did we find? What were some of the good things? What were some of the things that need to be improved? So we've pulled all that together. So if we use the example there of the things that could be improved, so we're thinking, right, we need to go forward and do something about how often we review our plans and also the risk assessments, because that person's need didn't make it into the risk assessment. So if we were going to write an improvement plan, what kind of things do you think we would put in there? What actions can we take forward from knowing that information to start our journey to improvement? So what kind of things could we do? So next slide, please, Anthony. Back on the AHA slides, what kind of things can we do now? What are we going to do now? What will our next steps be to address those things? So just reading in the chat here, there's a comment about 2 potential outcomes here, about the list of tasks accomplished and statistical information, and also the quality outcomes approach. And that's something we were going to talk about later as well, that idea that sometimes it's not just one thing or the other. You can have a look at your personal plan, so you can take that audit, but it might be a very tick list based approach, which isn't always answering the right questions. So your audit might have told you, yes, there's a review, yes, it's been updated, but maybe it didn't tell you, well, is that reflective of the person's current needs? It might have just been that kind of data. And we see that quite often in services where people have maybe more compliance-based audits or quality assurance documents, where it is just the presence of something meets the objective for that audit or that quality assurance process. Whereas what we say is, well, so what? Does that tell you what you need to know? And does that mean that that piece of information is good? So yes, you may have a review or a risk assessment in place, but does it do the job that it's supposed to do? If you've got a risk assessment in place, great, but has it been updated? Does it reflect how the person needs to be supported? Do staff understand it? Do staff know about it? Has it been agreed with the appropriate people? So there's lots of other questions that you're going to want to ask rather than just, does it exist? And that's often where people trip up. So we've got lots of people putting in there, what are we going to do now? So Discuss with key worker and ensure accurate update assessment and care plans. Share findings with staff, share the workload. Training and improvement, training. Key workers, discuss with key workers. Okay. So lots of different things there. Ask the right people to contribute, more involvement, training again. Update all plans not reviewed as soon as possible. So again, a couple of things I might just throw in there. So updating all plans not reviewed as soon as possible. So how are you identifying whether they've been reviewed or not? A few people have put their training staff. And again, I suppose this is a really easy one to kind of jump to. So if something's not been done, we need to train our staff. But maybe training's not the problem. Maybe your staff know what they're supposed to be doing and how they're supposed to be doing it, but maybe they don't have time to do it. Maybe they think it's somebody else's responsibility. Sometimes it's about unpicking these things as to why they've not been done. So, you know, it'd be a real shame for you to say, right, okay, so this risk assessment wasn't updated or the review hadn't taken place. We'll train staff, we'll make sure there's clear guidance on what they're supposed to do. So we'll put all this resource and effort, time, money into doing those things and then it not change. So as part of your self-evaluation, you're going to come back down the line and revisit this to test whether it's improved or not. And you might find that actually it didn't improve because maybe you addressed the wrong issue. Because maybe it wasn't about training, maybe it was about capacity or understanding roles and responsibilities. There could be a lot of different reasons why something doesn't happen in the way that it's supposed to. And part of that, what are we going to do now, is having a look at maybe why some of that has happened. So yeah, I think involving the right people, and some people have said, you know, about talking to staff. Yeah, ask the questions, ask, you know, what are the blockers? So if staff haven't updated these things, well, why not? And again, it's a simple enough thing. And usually staff are fairly quick to tell you, well, actually, we just don't have time, or that's not my job, whatever it is. And then you can go from there. And it might be about giving clearer expectations. Somebody's put here in the job description, having that accountability. But sometimes we need to set that out first before we can follow up on it. Involving members of the MDT. Yep, so that's a way to move forward with involving lots of people, but how is that going to address some of the other issues in terms of making sure that things are regularly reviewed? I think earlier on I saw people putting about trackers, review trackers and things like that. Always a great thing. And again, with most of these documents, as long as they're kept live, as long as somebody's job to be checking them. You know, you often see a lot of these trackers or spreadsheets and they're beautiful and, you know, they do lots of different things, but nobody actually uses them. So therefore, they're not really of any use to anybody. So again, keeping whatever it is live so that people are actually using it. And sometimes that's about setting up a process and a system where these things work and where you're involving other people. And I think we've had feedback from some people that have been using self-evaluation within their services to good effect, that it's often about some of the staff's understanding and getting them on board with undertaking some of the tasks so that it just becomes a more natural part of what's happening in the service. And we know lots of these things are happening in services because you're doing that quality assurance. You know, people are observing what's going on, they're feeding back about what's going on. You know, you told us earlier how you know what's good and what's not so good in your service. So those things are there, you're doing those things. Sometimes it's putting that system around it. Great, so lots of really good information there. Planning involving relevant people, review support. And again, it's just maybe narrowing down some of that. What are we going to do now to actual actions that help you move forward? and understanding why you're doing something and understanding what that's going to do. So how is involving members of the MDT going to work, and how is it going to solve the issue that you've found? So somebody's put there, the review trackers, quarterly information management reports. Yeah, and again, we see lots of really great quality assurance systems in place, but sometimes the content of that is a bit lacking, because it is more about compliance and having something present rather than it being fit for purpose and actually useful. And most of the time I find that that's where the downfall is. And it's not about reinventing the wheel, because sometimes you have these things in place and it's just about using them better and using them to their full potential so that they can really support you. Yeah, somebody said they're looking to why they weren't updated. Exactly, asking the right questions. Yeah, perfect. And again, once you've done all this, obviously you're going to want to come back and see, did it work? Did it not work? Were there things we maybe needed to tweak? Did it not have the impact we thought it was going to have? So lots of questions that you're going to continually ask yourself, and some of that is part of your improvement plan, and then some of it is going to be part of you coming back and doing another self-evaluation to see where you've moved on. Like I say, your improvement plan might be, well, actually, we started doing that and then we realized this was happening instead, so we've changed our priority, or we've moved to a different approach. And all that is completely valid, because that's just, how we work through things and how we understand how things are happening. And you're going to be able to measure that improvement, hopefully, because actually you'll have made your improvement plan, you'll have changed some of the actions you do, you'll have had those conversations with people. And then when you come to review this again in maybe 6 months' time, or whenever is relevant to whatever you're doing, you might have moved from that good that we had originally, and now it's very good and people are really happy and everything's working as it should be. Okay, next slide, please, Anthony. So we hopefully, technology allowing, are going to play a little video here, which is one of our improvement advisors speaking to a provider around self-evaluation. So some of you may have seen this before. It was in a recent webinar. It's about 10 minutes long, so it is a little bit long, but it is really interesting and gives you just a little bit of a different perspective, I think, on things. So hopefully Anthony will be able to play that for you now.
Great, thank you so much. Eileen and myself, Tales from the Sector, it sounds like a great TV series, doesn't it, or something? Well, we'll try to live up to the headline there. So Eileen, lovely to have you with us here, and you're working up in Fort William, yeah?
I am, and it's dry today.
Excellent. Well, that's always that's a good start to it anyway. Well, we're chatting today about self-evaluation, and I heard that you found self-evaluation a very useful tool and wanted to talk to you about it. So I'd love to hear a bit more. So just starting with that one, like, why did you find it useful?
I found it useful. I'd struggled for quite a long time getting the grades up in the home, getting the standards up in the home, making sure that we had consistency. So a lot of the time our staff were very good, but sometimes we really let ourselves down as well. And I was quite lucky because the company I worked for invested a lot in doing quality improvement, which then led me on to the self-evaluation. And then when I started actually doing the self-evaluation and doing it with the staff, because of the training my company had given me, then we were able to do exactly what's just been said, break it into small manageable chunks, recognise what we were doing well, but also not get negative about what we're not being well, find a plan for how we're going to put those improvements in place. And it made a massive difference to our last inspection, and it made a massive difference to the confidence of the staff, because we allocated specific tasks to specific people who were responsible for their own wee bit. So nobody was overwhelmed, but they were all able to move forward at the same time with the service. And it made a massive difference to the residents and the relatives too, because they felt really involved in the whole process. You're on mute.
There we go. Listen, that's really lovely. And do you know, there's so much there that you mentioned about spotting what you're doing well. And that's something that Anna had spoken about earlier, but noticing the good things that are going on. That's really important, isn't it? Because
if you always concentrate on the negative stuff, it's really demoralizing for everybody. And there's no home where everything's negative. Everybody that works in care is there to do a good job and to look after the people that we're lucky enough to look after. So nobody goes in with the intention of not giving great care. It's things happen maybe because the system's not right, because there's obstacles in the way of that happening, or people just don't maybe have the specific training in that field. But if you can break that down into the smaller bits and put that in place, then people thrive, both the residents and the staff.
Right. And then I love the other thing that you mentioned about is not getting too downhearted about the things that aren't going wrong. And I know in any sector, in any business, in any company, that fear of, you know, that feeling bad about things that aren't going well or something that's going wrong, and sometimes trying to kind of gloss over it or hide it or not face up to it. But it sounds like you're really saying, look, here's the stuff we're doing so well, and look, here's the things we aren't doing well, and that's grand. Let's do something about it.
It's very much breaking it into wee bits, and it's also recognising that even if we did miraculously get up to grades of 6s, a year later there'd still be stuff to fix. You're never not going to have stuff to fix, and it takes a while to get comfortable with that as a human being, because you know, most of us would like to do things right and do it right all of the time. An awful lot of us have trained really hard to get where we are, and I think for a long time I expected that eventually I would get to a certain level and be able to keep it there. It took a long time to realise that it is actually continual improvement means continual improvement. It's never going to stop.
That is so true. That is so true.
Once you realise it's not going to stop, it's a lot more manageable.
Yeah, and maybe everything will only be perfect. We'll be at the pearly gates or something, because you know that's humanity, isn't it? It's human beings, and actually that whole thing about continual improvement, that you know, we're not just stuck. That we're constantly interested and curious. But listen, tell me about, I know you tracked an improvement for every person who lives in the care home there. It was about connecting with family during COVID, and that tracking, I think people would really be interested to hear about. Could you tell us a bit more about that?
Well, it was great. I used the Meaningful Connection, the self-evaluation tool, to go back and look at it. But one of the major issues that came up in COVID was communication with family not being able to travel to come up and visit people and stuff. And I think everybody had major issues with it. Everybody rushed out and got tablets to connect people, and an awful lot of homes came up with really innovative ways of keeping people in touch. But it became apparent quite early on that certain people stayed in touch all the time, like their family would phone every day, and other people we weren't managing to meet their needs. So it's actually the activity coordinator, not me. I'm not taking credit for it. So she, with the feedback that came back from things like activities, what people were doing, relatives really wanted to see their loved ones and couldn't. She came up with the most simple plan you could possibly have. She had a list of paper with the residents' names down one side and a series of boxes. Has there been a photo of them doing an activity? Has there been a feedback of them doing an activity? Have they been in touch with a relative in the last week? And it is literally a tick box, and she's got 3 years worth of it now to make sure that every resident has touched base or done an activity, or even if we couldn't put a picture on Facebook, say it was somebody with very, very advanced dementia and it wouldn't be appropriate, she would send them a picture privately on Messenger so that they could, you know, still be in touch. And we carried it on. We've just kept carrying it on to make sure that everybody's getting included every single week. And there's something for every relative to see.
Do you know, I just absolutely love that example, and I'm sure everybody else in the call will as well, because it's that making sure that some people aren't left out, because you know, and that's whether you're working in a daycare centre or a care at home or care home, whatever, that some of us are more vocal and chatty and out there, and some other folk who are quieter or can't, you know, initiate things can get left out. And I love that way of just checking, is everybody getting connected and doing something about it? And you know, you've described all of the different ways that happened. And now there's one other thing around that, and I think that I'm sure you mentioned it. I just turn over my wee notes here. Yeah, it was on the issue of movement and activity, and I think you introduced something about the trip to the dining room and what you did differently around that. Like, what was that about? Tell us about that.
Yeah, this is another thing that's ridiculously simple, and I don't understand why I didn't think about it 20 years ago. So we've got, most of our rooms are upstairs and we've got a main dining room downstairs. So for years we've taken them downstairs in the lift and walk them into the dining room, which is great. It's a fairly decent walk for a lot of people, but they're not getting outside. And this is Scotland, so there's not much sun, and there definitely isn't where we are. So really, really simply, you know, our care inspector, Susan, had been in, and she was just pointing out about trying to get folk outside and making the most of our outdoor space, because we're very lucky to have really nice gardens. But there's a door out of one lounge, and if you then walk around the building through the garden, you can come in through the dining room. So what we started doing was taking people down, going out the lounge door, going through the garden, and then back into the dining room the other way. And that's now led on to having our alfrescos. We've got a wee group of alfresco lunches now. And as you know, if it's dry, they're out there and they have their lunch out there and they love it, absolutely love it. But it means that the majority of people are getting outside in a garden a couple of times a day, and we're not actually having to do anything extra for that. It's just a very slightly different route into the dining room. It's made a huge difference to the actual residents, because I see them now going, our gardens are enclosed so they can go in and out whenever they want. But the fact that we are taking them out is making them go out more and use it more out with the dining room times. And that's making a huge difference to them. They love it.
And I love from that conversation what you're telling me there, that point that your inspector mentioned something. And I think the really important thing, Eileen, is that you're listening. You listened, and rather than saying, plenty of people get outside, you know what I mean? You're looking at that evaluation thinking, I wonder now, gosh, maybe we can do something about this. And it looks like you're very open to hearing feedback or evaluations from other people as well. And I'm sure that's part and parcel of your success there.
You've got to stop seeing things as a criticism. Just because you're doing something wrong doesn't actually mean something's critical, and it doesn't mean it's wrong, but it does mean you've got an opportunity to make it better.
Okay, thanks for that, Anthony. So I hope that was useful to watch. I think it was really interesting, and there was a few key points within that, and especially that idea of, you know, not taking feedback as criticism, and, you know, gain that critical friend role, you know. So if you are maybe supporting somebody else's service or having somebody come into your service, it's about us not being precious about our services and taking feedback well, and as long as it is constructive and it's useful and people are helping you to identify maybe where developments or improvements can be made, you know, we have to sometimes be mindful that actually that is about helping us, and we have asked for that fresh pair of eyes to come in and they can see things that maybe we can't. One of the other things that they mentioned there was some of the focus tools that we have. So I'm hoping some of you will have already seen these, particularly if you work in care homes. So we have a focus area tool on meaningful connection. So that was developed by our Meaningful Connection team that have been working, really focused on Anne's Law over the past year and a bit, I think it is now. So they've developed that, and it really lines up with some of the toolkits that we've given to people. So it's that idea of looking at something really specific, like we've said, maybe choosing a key area. The difference with those tools is that they give you an idea of what the standards and expectations are really sort of explicitly within that. So down one side, there's that list of standards or expectations around meaningful connection, and then the opportunity for the provider to answer those 3 questions about, where are you at? What do you need to do to kind of move forward with that? So it's a really good tool if you're looking to do something very specific. We have one, like I say, for meaningful connection. There is also one within our children and young people services around restrictive practice. And we're going to hope to develop more of those as time allows us to do that, so that we can maybe focus in on different areas. And also some of our health improvement team colleagues are using that approach when they're developing some of their health improvement tools. So we present that united sort of approach to self-evaluation to support providers, supporting yourselves to kind of complete that and to understand the process, and that process be the same across the different sort of areas. So what we've got in front of you now is what we've called a self-evaluation for improvement cycle. This is something that is not in a finished format. It's something that we're asking for people's feedback on. So when we've done various webinars and face-to-face events with providers around self-evaluation, we found that people really struggle with that idea of self-evaluation being part of what you all do all the time anyway. And lots of people think it's this additional ask of services when it's not. But they're maybe not able to see how it fits in with their kind of everyday work and the things that they already do. So we've used this cycle to try and show people where self-evaluation is and how it links to other things and how it links to that improvement journey that everybody is already doing. We've had some quite positive feedback so far that it's helping to clarify things for people, but we do want your feedback on it. Is it helpful? Is it not helpful? Or other things that, could be added to it to make it more helpful? So please do either use the evaluation form at the end, or you can put comments in the chat if that's useful for you. I think while we go through this, because we still have a couple of slides left, Linda's going to pop in that evaluation form so that people can have a look at that before they shoot off at the end of the session. Okay, so like I say, what we've got here is self-evaluation, but within that cycle for improvement. So starting with that, identifying your focus, and that comes about in, all different ways. And that's about whether maybe it is a requirement or an area improvement. Maybe you had some feedback from a relative. Maybe you specifically went and asked for feedback on a particular area. However something came to you, that's valid. It doesn't really matter how it came to you, whether you sought it out, whether it just came by accident, whether it was something that, you were walking around your service and you observed, where it came from, not really the issue. But the fact is that you've identified a focus. You've seen something that's kind of piqued your interest and you think, oh, I think we might need to have a look at how we're doing with that. And then you've gone and you've gathered your information or your evidence. So maybe you've done an audit, or, it's been part of quality assurance. Again, maybe it was an observation, maybe it was something you saw or heard, or part of an activity that was taking place. You've then made an assessment about it. And that's your how are we doing question there. So you've made that assessment. You've thought, okay, yeah, that's just what happens on a daily basis. Don't think anything more of it. Or you've thought, okay, yes, we need to make, further investigation, so to speak, into this. We need to look at this. We need to figure out what people think about this. So maybe you take that step forward with a more formal self-evaluation and start asking people, right, okay, where do you think we're at with this? And maybe then that promotes some more feedback that's going to come from staff or more relatives or whoever it is. So you're going to know how you're doing there. You're going to be evidencing that. That's building your evidence when you're asking for your feedback, when you're maybe taking that closer look, having that, clear, focused, maybe a quality assurance activity. But that investigation aspect of unpicking something, going, well, actually, what is going on here? What's informed, your thinking around that. So how do you know where you're at with that? Was it, well, actually, we did some observations and, we didn't think that this was where it needed to be. That's going to then help you identify your areas for development. And that's your what are we going to do now question. You've heard something, seen something, you've looked at it in a bit more detail, and now you're thinking, well, we need to do something about that, need to move it on. And that's where you plan your changes. So, this may or may not previously have been in a development plan or an improvement plan, but this is the way in which you work. This is the way in which we kind of look at things. And, we work in this way, maybe unconsciously or informally every day. So we're planning that change. What we're going to do about what we've seen or we've heard or we've found. So, how are we going to fix this, or how are we going to improve it? Who does that involve? What do we need to do? And then you're going to look at how you've done with that. You're going to review that improvement plan. And again, that's just part of the way that you work. You identified right at the beginning, whether you're doing well or not so well because you do all these other activities. That is self-evaluation, but you maybe just need to put a structure around it. Sometimes it's not all about doing something additional, but formalizing what you already do so that it meets something specific. So that assessing your impact, the so what question, did it work? Did it not work? And if it did, well, did it do what you wanted it to do? And, that might be no, it didn't. So we may have to kind of go back to the beginning and look again at, well, was that the right thing that we were looking at? Was it something else that was actually going on and we maybe misunderstood? Or maybe we didn't actually intervene in the right way and we need to relook at the steps that we took at the kind of, improvement plan stage. So it's just bringing it all back to those things that you do every day in your services to make them work, but putting a structure around it. It's nothing new, it's nothing different, and it's what you've always been asked to do. There's always been standards and expectations for you to meet, whether that be health and social care standards, the previous, old booklets that we used to have with the national care standards in them. There's always something there, and that might be legislation or standards or good practice guidance. So you're always working towards that, and you're always, evaluating where you're at with that. So this is nothing different from that. But like I say, it's just being formal and putting a structure around it and making it clear that you know where you are at and where you need to improve, because that's what's really important, that services know that for themselves and they're able to understand that and share that as well. So hopefully that makes sense to people. Next slide, please, Anthony. So we've already mentioned a few things that we already have in place. So we have information on our hub and also on our website. And I put the 2 links into those places earlier. So on the hub, we have this improvement support section. And this is something that we've worked on building over the past year or so to try and keep everything in one place. So within that section, you have your quality frameworks, you have some previous webinars, and you have the self-evaluation toolkits and some improvement tools as well. So all of that is there. And on the website, under publications and statistics and then professionals, there are self-evaluation toolkits, there's also copies of all the different frameworks that we have as well, amongst other things. Somebody had fed back to us the other day that within our guidance, within the toolkits, the link is out of date. So the link that's there that took you to, I think it was the model for improvement, is no longer working. But you can find that in those places also. So that original guidance, which Linda mentioned earlier from 2019, which gives you kind of the theory behind the model for improvement and self-evaluation, that is still in all these places as well. So don't worry that the link's not working, because you can still find that quite easily within the links that we've shared earlier on. So as well as that guidance, we have the toolkits. The more up-to-date guidance forms part of that toolkit, as does a number of templates. So we have a improvement plan template like the one that you saw earlier. We also have some variations on questionnaires. So for each framework that we've published a toolkit that matches that framework. So it has slightly different questions depending on, who the framework is for, different sectors. We have a worked example within that, I think ideas for focus groups, things like that. So there's a variety of different tools and templates within that. For things like the questionnaires, we don't expect you to just lift those and use those. They're just example questions, so they're quite random, different questions across lots of different key areas and questions within the framework. But use the format if that suits you. But again, it's just giving you an idea of what this might look like, some of the ideas of things that you might ask, but tailor it to meet your service. And like Linda showed earlier, that might mean doing it in a different format. That might mean, using more pictures and less words. It might be about engaging on a one-to-one basis, or, verbally with people to support their understanding. Again, tailor it. So hopefully all of those are useful. Like I say, you have got the link to the evaluation form. So if there are things that we haven't given you that you think you need or you think would be useful, tell us. I mean, we can't promise we'll deliver them, but at least we know, and then we can try and see where the gaps are for providers as well, in terms of how we're supporting your understanding of self-evaluation, because this is the way that things are going, in terms of there's a push from Scottish Government to make self-evaluation, part of what we do and how we do it. So self-evaluation is really important, and it's important that we support you to understand how to do it and how to do it well, and minimizing, any kind of additional expectations that people think it creates, because, hopefully we've shown you that actually it's just about thinking a little bit differently rather than creating a lot of additional work for yourselves. So Linda's just mentioned there, yeah, we have bite-sized videos due to come out. So those are ones that Linda's done some work on, and they're really useful, short, as the title suggests, bite-sized chunks of information. And I think they'll be particularly useful for sharing with staff as well, giving some of that information to staff and seeing where they can participate in self-evaluation. They're very easy to understand, very accessible, and like I say, very short videos. So that will be coming out as well. So we can open it up. But is there any more questions that people have? Anything people want to know? I think we've answered most of the things from earlier in the chat. Do people want to ask anything at all? Can't believe we'll have absolute silence. Linda, is there anything you'd like to add while we wait to see if anybody's got any questions?
No, I don't think there's anything else that I need to add. Someone's asking about the recording being available to share with our managers. So I'm assuming that will be part of this presentation still.
Yes, so long as technology behaved itself. yes, we will hopefully be able to share this. And like I say, hopefully it's been useful, but do please fill in the evaluation so that we can see, you know, how we can make things better and deliver more useful things for you. So we've got no questions coming through, which is very surprising. Anthony, can you just put up on the last slide? So there's a couple of email addresses just on the last slide. If you do want to contact myself or Linda, like I say, Linda's from our improvement team, I'm from our methodology team. So hopefully between the two of us, we'll be able to answer most of your questions. So if there is something that suddenly comes to mind, just drop either one of us an email and we'll be able to get back to you. Okay, so we've just got something. Will CI develop a more accessible questionnaire for people with learning disabilities to complete? Do you mean in a template or part of the way we collate feedback? So in terms of a template, the answer would be no, because we want you to do that to reflect whoever it is you support, because we would never be able to do examples of everything that would suit everybody. Part of the way we ask for feedback, yes. We have, depending on which sector you're in, or depending on what information you are aware of, but when COVID hit, we stopped sending out paper questionnaires at the time. Those are being brought back in to support accessibility for people. We also have MS forms, right? Yeah, MS questionnaires via MS forms. And we are also trying to develop more accessible formats for that. We are also, part of methodology's work plan is looking at how we get feedback, and also making sure all of our inspectors are up to date in terms of different kind of ways to communicate with people, and ensuring that, you know, when we're out on inspection as well, that we're able to communicate with people. So yeah, we are hopefully developing the way that we do that, but it is a very long process, unfortunately. So yeah, hopefully that'll be useful. I know we've previously had questionnaires. Yeah. Yes, they have been quite inaccessible. We did previously have more accessible questionnaires, but again, they were all stopped. So nothing's been going out recently in terms of paper ones at all. But yeah, so we have a working group that I'm actually part of that's looking at all of these issues with our questionnaires. So it is something we're well aware of.
I think there's some work going on. It's in children and young people, but I think they're looking at the use of videos to do feedback to services as a sort of pilot. But then I think they might expand it to how they could use maybe videos for other things as well. So that's maybe something that we can take on board and pass on.
Yeah, so Anthony's actually a part of that group, and it is looking at that. They have currently trialed user videos to give feedback to people, well, children and young people that use the service. So that's feedback at the end of his inspection. Yeah. But yeah, that idea. And we also have somebody called Nikki Cronin as part of our improvement team. He's a senior improvement advisor, and he is all about the tech. So, you know, how can people be involved in inspections? You know, how can we maybe support the use of more tech, you know, with people? But again, you know, lots of these projects ongoing, but like everywhere else, we have our own sort of resource issues to contend with. So things aren't moving particularly quickly on any of those fronts, really. But we do know it's something that we need to pay a bit more attention to ensuring that we get that right, and that we can hear people's voices when they've got something to say to us.
Yeah.
Okay, great. Well, thank you everybody for coming along. Thanks for your time. I know time's very precious for everybody. And like I say, do use the evaluation and enjoy the rest of your day. Thanks again for coming.